Hi friends, welcome to Smile Nursing tutorial. I request you don't skip in the middle of the video. You may miss some important meanings or words. So if you see total video, it is very useful to in your life. Now today we are going to see the KMC, Kangaroo Mother Care. So how to provide? Now I am going to tell one by one. First we have to provide privacy to the mother. Again we have to request the mother to sit comfortably. Next, undress the baby gently. Keep the cap, nappy and socks on. Place the baby prone on mother's chest in an upright and extended posture between her breast in skin to skin contact. After that, turn the baby's head to one side to keep airway clear. Understood? Cover the baby with the mother's blouse, pallu or gown, whatever the mother is having. Next, wrap both baby and mother with a blanket or shawl. After that, we have to ask the mother to breastfeed the baby frequently. If possible, warm the room with a heating device. If the mother is not available, skin to skin contact may be provided by the father or any other adult. Okay, now we have discussed about the KMC. When skin to skin contact is not available, what we have to do? So first keep the room warm with a home heating device. After that we have to clothe the baby in 1 to 2 layers like summer. Clothe the baby in 3 to 4 layers like a winter and cover the head, hands, feet with a cap, gloves, socks. Okay, let the baby mother lie together on soft thick bedding. Next, cover the baby and the mother with an additional blanket. Like that we have to provide. Thank you for watching this video. If you like, share, subscribe and comments.